The Ministry of Health has confirmed the highly infectious Candida auris super fungus that's been spreading rapidly across the US is now here in New Zealand. Epidemiologist Michael Baker says it's unlikely to affect people in the community, but it will be another burden on our already strained health system. Keisha Brownlee reports.
Move over COVID-19, the Candida auris fungus has arrived in New Zealand.
It's an uncommon infection. It's a yeast, and if it enters the bloodstream, it can then cause infection in different organs in the body, and they can be very severe.
The Ministry of Health says the case was acquired overseas. Cases in the US have tripled over the last 3 years. The COVID-19 pandemic could be partly to blame.
And some of the speculation is, the hospitals were very crowded. Everybody was wearing PPE. It was a crowded, moist, warm environment.
Compounded by high antibiotic usage to kill normal bacteria, allowing the drug-resistant yeast to flourish. The Candida auris fungus mainly affects people with compromised immune systems, living in aged care facilities or hospitals, and patients who have devices entering their body like intravenous lines or catheters. Symptoms vary depending on the infected part of the body, but common signs include persistent fever and chills. The fungus is drug resistant and most usual disinfectants won't work.
And this sounds like quite a worrying new infection, and it is for our healthcare system, but the average person in New Zealand doesn't have to worry about this infection at all. They're not going to get this infection.
The Ministry of Health says our hospitals have good measures to minimise spread, but could there be more?
And I think if we've got somebody returning to New Zealand who's been in a hospital overseas where that yeast has been a problem, we should consider whether we want to do surveillance cultures.
The good news for New Zealand is we can eliminate this infection if we identify all the cases and they're very well treated and we have very good infection control in hospitals. That will be the end of it.
It's likely New Zealand will get more cases in clusters. Keisha Brownlee, Newshub.